Good afternoon. Welcome to Wednesday Live with me, 𝐿𝐴𝐻 James. Welcome to 𝐻𝐶 Academy Reading Live. Hope you're all having a lovely day, because as you can understand from the sound, the modulation that I'm bringing, I'm very, very, very happy, because another more than 100 number of students have made to their dream, isn't it? And a lot of people have got stunning scores. Stunning scores means absolutely stunning on the aspect, not just 400, n number of 400s. So yes, always a result day is always both, isn't it? Two sides of the coin. Why? Because there are certain students who have not made just by a whisker. That is also there. Okay, but of course, it's an honor to come and tell that we, as from 𝐻𝐶's family, we're all proud of all our lovely students who have made us, elated by looking at their scores. So I hope you all have seen those gorgeous faces. As we always promise, we always believe in our students' capability, because they make us so proud. They make us so much happy with their stunning results every time. So yeah, it's an absolutely amazing day. The very next day, as soon as you complete the result, every time when the student calls and says, "Sir, I'm so happy because I made it to my dream." What else could you ask for, isn't it? Being a trainer, what else can you really ask for? Okay, even though it's that student's perspective, because it's their hard work, it's their effort, but they're very happy. That's that smile that you can relate when you really achieve something, isn't it? Anselin Verghese, good evening, a very good evening. A new name, Anselin. May I know if you're attending the live for the very first time? If so, please do let me know that you're attending for the very first time. Or if you can, please do let me know where you're from. If it is okay, it's not mandatory. But yeah, I would definitely love to know where my students are from. Fair enough, as students are piling up, if you feel that you need a professional approach, do not forget the number is there, 974-7944-374. They'll be happy to assist you. And as students are popping up, I would definitely want you to start realizing that 𝐻𝐶's Academy is not for, we don't have more than 2 groups in Telegram page, because there are students who keep on telling, see, please add me in writing group, please add me in listening group, please add me in speaking group. We do not have those kind of groups. We only have 2 groups. Okay, one is an official 𝐻𝐶's Academy Telegram page, and the other one is an exclusive reading Telegram page. So it has only 2 pages. And again, just a request, because most of you are unaware that there are fraudulent people available. Okay, they know how to trick people. So when a genuine student doesn't, see, we are not as crooked as them. So what happens is they will just simply put a post saying, anybody have this answer key. So being very, very sweet person, what our students does is they post the answer key, because they don't know that when you post a copyrighted answer key in a public platform, Telegram will ban you. So what happened? They don't realize it. They feel that the academy has banned. So what these people do, they'll contact you personally and say, see what happened when they do, this is what they do. They only want that. They only want this. These kind of unethical, these kind of venoms are pumped into our students. Then what they do, they try to steal the students' money. So please be aware of it. Even, I'm not saying there are not genuine students who ask for answer key, but if you want, you can share the answer key to them personally. Okay. Apart from that, don't ever post an answer key on a public platform. Okay. Just a precautionary warning. And we have WhatsApp channel, and the WhatsApp channel page is also we have just pinned the 𝐻𝐶's Academy social media platform that we are aware of. Yeah. So Naina Babu, good evening. Soumya Saju, good afternoon. Ashna Joseph, good afternoon. Priya Rakwal, good afternoon. Anita Simon, good afternoon. Jilmi Joy, good afternoon. A very, very, very good afternoon. How many of you have seen the gorgeous 100 and plus students' faces? Did you all see Grishma Devasya? Good afternoon. Did you all see those lovely faces and the scores that they have got? It's an absolute, a very, very, you can, I don't know whether you can, we always love to picturize what is that, feel that they are going through when you get that dream score, isn't it? After putting in a lot of effort, hard work definitely pays, right? So if you have not yet, please do pop in and see. Maybe you'll have one of your friends there as well. Okay, so just pop in a small time to say congratulations to them, because we believe in family, because all of you are our family members. So when one of our family members get over the line, we're happy. If not, if anybody who haven't, buy a whisker, we're there to assist you. Josie Sarjan, good afternoon. Nice to see a lot of mix of people. Okay, few are new names, but nobody have told me that you're attending the live for the very first time. So I always believe that you have been there, right? So because it's what can you say? It's a festive mood when a lot of people. Monica Vegas, good afternoon. So a lot of people, a lot of lovely students as well. Okay, it's you can't just stop congratulating all those people for their hard work. Right. And what are the most important things? See, yesterday we were talking about the importance. See, come what may, let it be 8 minutes, let it be 20 out of 20, let it be 400 out of 400. See, these are all possibilities, isn't it? See, if you really look into that list, you can see a lot of students who have got not just one 400, two 400, minimum one. A lot of students. Now, what is the factor that 𝐻𝐿𝐻𝐿, good afternoon? What is the difference? Why do they get that? What is the trick behind it? See, there's no trick behind your hard work. Those are students. Monica, I'm very, very sorry to hear that. Because I was expecting your name yesterday, but may I know which one you were not able to? And of course, see, Monica, do not worry. God has a plan. As I've always mentioned, when you were in the class also, I've told you, God has a plan and He has a much better score just for you. All right, Ambali Philip, hi. Kavita Balaji, good afternoon. So, Monica, I'm so happy that you are there in front of me. The biggest thing that you always have to understand is to make sure that you all realize, okay, see, maybe a small mistake, I don't know which one, just going to see, wait, if you're able to let me know which one you were not able to get the required score. Tangasudha, good afternoon. But I'm sure that God has a greater scorecard just for you. Okay, fair enough. So do not worry about it. It's just those things that can be. The C plus is not bad. Okay, so don't worry about it. I'm sure that God has a great score in front of you. Okay, like Monica, there are a number of students who feel, okay, this is not going to be something that is for me. Not at all. Okay, mark my words, with your effort, with your enthusiasm, with your concentration, with your thing. Cynthia, good afternoon. Ashna, 𝐻𝐿𝐻𝐿, good afternoon. Priya, true, sir. God has a huge plan for everyone's life. Keep on trying. Absolutely. See, because I'm a person who have been writing a lot of exams. Okay, now every exam when I write, I know, see, after that exam, I know, okay, this is where I made a mistake. Next time I rectify that mistake, but maybe another mistake comes in there. So there is always an end. God will grant you a scorecard which you will be so proud about yourself. Good enough. So do not worry. I'm sure, Monica, next exam is your exam. So do not worry about it. Okay. Just keep on practicing. Do take an exam. See where you have gone. What was the mistake that you have made? Rectify it. It is going to come your way. Geetu Soni, good afternoon. Lissy Augustine, hi. A lot of known names and new names as well. Dolly Anthony, good afternoon. Good afternoon, good afternoon. So, as I mentioned, I hope all of you have seen those students who have got that stunning scores. Yeah, please do go through that. And you also say, see, I'm going to have this picture there saying, I will have this picture there saying, I have made, this is my dream score. Good enough, Monica. This should be the spirit. There's always a number which Almighty have embarked on us. Right? Till that number comes, it is gone. My number was initially 7, then I had to write for another 5 more times before I got a very much of a different required score. It is there, it is possible. Thanks a lot for your motivational. Do not worry, Monica, because I know what my students are going through. But whether you like it or not, you have that kind of a brave heart on the aspect saying that, see, this I didn't. Okay, now next one, this is what I'm going to get. That should be the focus. Forget what is in the past. Focus on your future. You'll all be there. So, Monica, mark my words, the next exam that you're going to write, you're going to come and say, sir, I made. This is my wonderful scorecard. Mega Charles, good afternoon. So, yes, as always, we'll be going and tackling the first part B, okay, where the question will be popping up. So, I want all of you to focus on the time as well. Okay, I want all of you to compete with yourself, not with anyone. Do find the answer to the question as quickly as possible and then put a thumbs up saying got the answer. Don't type the answer. I'll tell you when to type. So are you all ready for today's session? Yes. If so, give me a quick thumbs up. Let me see how many of you are eagerly waiting for today's session. And of course, I would definitely request all of you to like the page that you're watching, follow the page that you're watching. Please do subscribe to the channel. And the small thing for me is, if you feel my classes are beneficial and if you think it can benefit somebody else as well across the globe, please do not forget to share on your very same page. Kavita Balaji is ready. Good enough, good enough. Maria is ready. Good. Good enough. Ashna Joseph is ready. Right, there are a few thumbs up going in. I don't know who that is, but of course, I know that all of us are eagerly waiting. So I'm not going to keep you waiting. Anita Simon is ready. So the material will be popping up. Divya Divi, ready, okay. Sri Chitra, good afternoon, ready, very good. So I'm not going to keep you waiting. The material will be popping up on the screen, and do beat the time. There you have Priya, Soumya, Tangasudha all ready. Binsi ready, okay, good enough. Surya Manish, good afternoon. Okay, time. But I'm happy that Geetu was the first one to say done. Priya Rakwell done. Neetu Getchellapin done after a long time. Neetu, okay, fair enough. Maria done. Anita Simon done. Kavita Balaji done. Fair enough. So I know that you're all eagerly waiting to tell me what is the answer. I'm not going to keep you waiting. Please do let me know what is your answer and where you got that answer from. That where is very important. Okay. Monica done, Ashna Ujjwal done, Josie Sarjan done, Sri Chitra done, 𝐿𝐴𝐻𝐿 done. Okay, good enough. Ashna Joseph done. Right, what is your answer and where you got that answer? That is the important part now. And why it is important? Because we always believe, if at all you have found the right place, absolutely appreciate it. If you found that somewhere, depending on how you comprehend and all those things, if it is not the right one, we are here to assist you. Thangasudha done, Binsi Lukos done, Saumya Saju done, Naina Babu done. Okay, fair enough, absolutely good enough. Would you be kind enough to tell me what is your answer and where you got that answer from? That what, where is important. Priya is the first one to say B from overall. Para, okay, fair enough. So I have the first answer. 𝐿𝐴𝐻𝐿 is also saying B from second, last few lines. Okay, fair enough. Anita Simon, B from overall. Josie Sarjan, B. Okay. Naina also saying B. Fair enough. Thangasudha, B middle. Kavita Balaji, B from overall. Okay, fair enough. So generally everybody is standing for B, is it? Fair enough. Even though not all of you have responded, but I don't know why. See, even come what may, whether it is right or wrong, see, when you want to learn, you have to know the purpose of why you're attending a class. You have to know the importance of commenting the answers. You have to know the importance of getting wrong. Understand? It's not just right. See, please understand, when a student enters a class, see, I always tell my students, see, you're not here only to say the right answers. Wrong. Okay, see, you are here to say an answer which you have got. And our job as trainers is to correct you. Isn't it? So you have to always remember that. Clear? So I don't know whether is there anybody else with any other answers. Is that the reason why only B is coming? See, I'm a person who always believes first step you have to take. Then your journey is already there. Okay? But again, anyway, Saumya Saju, B from middle. Let's see. Now the material will be popping up back on the screen and then we will be discussing. So what are the fundamental things that you have to always remember when you're doing part B? First and the foremost important thing you have to always remember, it will be a medical related workplace communication. And it will not be from n number of paragraphs. Out of the many paragraphs, they'll take one. The most important thing you'll have to always tell yourself, see, the answer to the question should be mentioned in the given paragraph. Not by word meanings. It is the overall gist. Paraphrase, of course. Now, three things that you have to do when you're doing part B is, one, read the question. As you read the question, underline the keywords in the question, understand the question. Very, 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 very important. Now see, on the question, the patient safety leaflet encourages patients to, now see, okay, so the patient safety encourages patient to. Now whose perspective? Patient to. You're asked to find patient's perspective, so what are you to do? Read along. I've told n number of times you're supposed to read along with your question, because there's no, it's not ending with question mark. Okay. Now, patient to check the nurses understand the medicine guideline. So who should understand? The patient should check. Who? Nurse understands. Understand. Next, patient to ask staff to clarify the direction to follow about taking the medication. So patient should ask the staff, how can I take it? Or what are the things that I have to be cautious about? Should I take it? What? Or patient to be sure the doctor asks questions about your medicine. Patient should ensure that, see, doctor, ask me. Is that going to be a possibility? Now, after doing this only, I'm going to read the paragraph. So don't skip anything. So you have to always remember, even a heading, subheading, everything is important. So patient safety advice medication. It is important you keep track of your medicines. Okay, so please be aware of it. You should keep a track of your medicine. Taking the right medicine at the right time will help you to get well. Using medicines in the wrong way may cause unwanted side effects. To be medicine-wise, that means you should know what you have to take, when you have to take, how much you have to take. To be medicine-wise, in hospital, you need to tell staff if you had an allergic or bad reaction to medicine. So please ensure that you're communicating with the staff saying that, see, when I took last time, I had this, rashes came on me. I had this, whatever, the after effect, if at all. Then, or if you have trouble swallowing, see, I am having some problem swallowing medicine because every time I try to put something, it just, whatever. Okay, so nothing to do with all those things. Now, you should tell staff straight away if you feel unwell after taking any medicine. So they're saying, okay, see, you should tell the staff saying that, okay, when I took this medicine, I was a bit unwell. I had this giddy feeling. I had this dizziness happening to me. I had this nausea coming in. I vomited. Let staff know if you think you should have received some medicines or medicines appear different. See, last time I took this medicine, it was pink in color. Now you're giving me a medicine which is yellow in color. If at all, you have all the rights. The patient, okay? We are all asked to do the patient's perspective. It is important that all medicines are explained to you before you leave the hospital to go home or another care provider. So they should let you know, okay, see, these are the reasons why it is important for you to take this. Always ask your doctor, nurse, pharmacist if you don't understand your medicine instructions. So again, slightly saying, ask staff. If I don't know, see, doctor, you told me that I have to take it before food or after food. Clarify it. Because why? The right medicine at the right time will help you. So, question you should always ask about your medicines in the hospital. What is the medicine for? Are there possible side effects? Can they be taken safely without the medicine? If you have any doubt. So now let's see. Easiest way to eliminate, isn't it? I'm a person who always believed the strategy for part B, elimination method. Now let's see. Check the nurse understand medicine guidelines. Straight eliminator, not mentioned in the paragraph. Be sure doctor asks questions. Nowhere it is saying that the doctor will ask questions. So 2 eliminated. So the given answer option is B, which all the students have, whomever have commented, have said, right, absolutely good enough. I hope I'm clear to each one of you. Any doubts? You're always welcome to clarify. Is there any doubts with regards to any of the way that I've communicated or anything that you're not sure about? Please be kind enough to clarify. Any doubts? Maria is dancing. Good enough, good enough. I love when students enjoy their achievement. Fair enough. Tangasudha happy. Priya Rakwal happy. Grishma is happy. Good enough, good enough. Keep on smiling. Good. Kavita Balaji dancing. Excellent, excellent. Anita Simon. Good enough, good enough. Ashna clear. Okay, good enough. Josie. Okay, good enough, good enough. Geetu Soni. Yes, happy, happy. Good, good, good. Manu Matthew. Very happy. Okay, fair enough. So because you are all having happy and you're all dancing, there's no one who's having any doubt. So let's go to the next. What is the next one? Next one is today's part A, which we have already shared, and it is percutaneous nephrolithotomy. No doubt, clear, Sumi. Okay, fair enough. So I've told you the material name. I want you to tell me how you felt about today's material and how many minutes you took to complete the material. That means all the 20 answers, how many minutes you took. Naina happy, Vincent Lucas clear, very good. So I've told you the material, percutaneous Nephrolithotomy, lithotomy, tomy, anything is okay. To be very, very precise on the medical perspective, I think it is nephrolithotomy. Thangasudha, easy, 12 minutes. So first material, very good. Geetu Soni, easy material, 10 minutes. Jilmi, easy material, 11 minutes. Absolutely stunning students you all are. Kavita Balaji, as always, very precise, 10 minutes and 40 seconds. Absolutely good enough. Good, good, good. Anita Simon again, very precise, 12 minutes and 8 seconds. Easy. Okay, generally the past few days, all the materials are easy. It is not because that it is easy. It is because you have come into the system of right way to find the right answer. Good enough. Right, from what you have told me, all of you say that it is easy. So the material will be popping up on the screen and then we will be talking about. So what are the fundamental things that you have to be aware of? The fundamental thing that you have to be very much sure about is what is the strategy. So the strategy for doing part A is called skimming and scanning. What is the strategy called? Skimming and scanning. So scanning, detail look, skimming, quick look. How much time? We have only 15 minutes where you are expected to tackle 20 questions. Okay, so how much time can you take? Skimming should be done in 1 to 2 minutes, but I say 15 seconds each text. You have 4 texts which is based on one common theme. Okay, so today's common theme is percutaneous nephrolithotomy. Okay, so what are the things that you have to underline? You have to underline the keywords. Now, what are the keywords? We have already told in n number of times in many of the videos, or if you're not sure still, go back on the very same page that you're watching, date back, see which is the one which has the highest number of viewers. That is the material. All right, do listen to it. Jot down those things which I've told you there. By heart it. Okay, these are the things that I have to do. These are the things that it should be there. Do it. It is going to be piece of cake. Okay, so what are the things again? So there are 20 questions, and what are the things that you have to do? Skimming, how to do, what are the times? So 15 seconds per question, so maximum of a minute. You are not expected to read word by word, or not. You're going to quick read it in order to understand the gate. See, the more quick you read, the more better you start comprehending it. Okay, percutaneous nephrectomy is surgery to remove the kidney stones. It is too large to pass on their own, and healthcare providers said percutaneous PCNL. The other method to pass the kidney stones is not possible. Percutaneous means your procedure through the skin. Nephrectomy means the removal of calculi, kidney stone from the kidney, and then our success rate of percutaneous 35 to 90, and between 20 to perform 20,000 PCNL. Done. Likewise, you should know. Okay, what did you understand? It is about something in kidney stone. Then they're saying about the percentage. Then they're talking about what is the success rate, who uses it, what is the meaning. Done. Likewise, during most PCNL, you lie on the stomach. So during procedure, anesthesiologist, so lot of sheath, nephroscope, lithotripta, all those things, urine, pee. See, continuous bleeding, intermittent. So all the complications, isn't it? Adverse reactions, post-operative care after the surgery. Done. Okay. So recover, what are you to do? Then go to the question. So 3 types of questions are there for 20 questions. So 1 to 7, these type of questions are called match the following question, where the instruction clearly says you are expected to write any of these letters. So what are the letters? A, B, C, or D? And you may use any of these letters more than once. So here also the strategy is very different. You're going to underline the keywords. Part A is purely keyword reference. Okay. Now see, when WH questions are very, very, very important. When percutaneous nephrolithotomy becomes inevitable. Inevitable means unavoidable. Okay. So those kind of things are very, very, very important, those keywords. So where are they saying, why is it important? We just marked, isn't it? When other methods to pass kidney stones are successful, you're going to use PCNL. So the answer is A. Understood how you refer? Now, instrument employed. So device employed to visualize and pinpoint. So it should definitely be during procedure, isn't it? So B. Mamta Malik, after some time, Pune, no? Pune or Bombay, can't remember, somewhere there, no? Again, nice to see all of you. So visualize, pinpoint kidney stone. So something to do with B, definitely, isn't it? So where are they saying? You are using a nephroscope or Punjab. Can't remember. It's a bit because I haven't, yeah, Punjab. See, we're somewhere. Okay, good enough. Right. So how frequently, so the time duration. Okay, how quickly, how often should the patient change the gaze dressing or gauze dressing? So definitely during where? After, isn't it? When they have done that only, you are applying that. After that, so how often? One or few times over 20. So fair enough. So the answer is D. My memory is still working. Okay, good enough, even though it's a bit confusing. So rationale behind instructing patient to assume a prone position. Why do they tell? Or the reason to tell the patient, okay, you lie in one particular position. So again, it should be during procedure, isn't it? Not post-operative as of now. So again, why are they saying? They're clearly saying you may be asked to lie on your back and your back where cushion and all those, so the urethra can access your kidney through the back. That's it. Who are assigned to perform? So somebody who is assigned to perform. Who is going to do that? Definitely it should be there in A, isn't it? Urologist. It's the only place where it's an easy answer. Urologist who specializes in kidney stone typically performs PCNL. What post-operative imaging? Post-operative imaging verifies procedural success. So post-operative, something to do after. So where are they talking about after? D, isn't it? So this is how you should relate to it. Potential adversities. So adversities, complication. So what are the things that you have to really look into as complications in percutaneous? So what are the possible complications? So they are talking about something in C, isn't it? So complication, why? All those continuous bleeding, intermittent bleeding, not critical treatment, standard treatment, renal, all those things are mentioned there. Now question number, next set, 8 to 14. 8 to 14 are called short answer questions. So very good. Maria is getting 7. Kavita Balaji is getting 7. Good enough, absolutely good enough. It's all your hard work. So answer each question. So short answer question, strategy remains the same, but your instruction is a bit different. So you have to be very cautious with that. And these instructions are all have to be by hearted. Okay. Now 8 to 14, the answer can be a word. Very simple, a word, short phrase, anything between 2 to 3 words, or it can be words, numbers, or both. Monica Vegas is happy. Good enough. So now go to underlining keywords. So what is the specific term for device used to disintegrate? So that means to break it into pieces, isn't it? Stones into smaller fragments before extraction. So before extraction, what are they going to do? What is the device that is, or what is the term? What is the device name? So where are they talking about? During, isn't it? So in some cases, the urologist may use a laser or shockwave device called lithotripta to break the stones into smaller pieces before removing it. So it is lithotripta, LITHOTRIPTER. Good enough. The management modality, so something to do with management modality that could be adopted in the event of ineffective selective angioembolization. So selective angioembolization is a straight answer in C, isn't it? That's the only place where that word is, selective angio. So what is the thing? The next thing, what is the alternative? So what is it? Nephrectomy may be required if selective angioembolization fails. So the answer is nephrectomy, NEPHRECTOMY. Good enough. So what is the estimated efficacy, estimated average efficacy rate of percutaneous? So definitely they're in A, isn't it? Why? Percutaneous has a success rate of approximately 75 to 98%. So 75% to 98%. Straight answer. Good enough. Now, what is the precise term? So precise term, specific term of the instrument inserted into the sheath to discern and extract renal calculi. So calculi or kidney stone, isn't it? Another term for it. So again, go to, so what is the term that you're going to do? It is going to called as, see, they will then insert a small video camera called the nephroscope into the sheath to locate the kidney stone. So nephroscope, N-E-P-H-R-O-S-C-O-P-E is the answer. What condition? So definitely a disease condition might be experienced with sporadic bleeding post-surgery. So some state, isn't it? Sporadic bleeding means intermittent, something which is not regular. So where are they talking about? Post, sporadic, intermittent. Where are they talking? Are they saying anything somewhere? Yes. Where are they saying? Intermittent bleeding is there. So what is the thing? Arterial pseudoaneurysm. So ARTERIALPSEUDOANEURYSM. The extracting of which a rigid deposit. Rigid means something to do with as hard. People call me rigid. Yeah. So hard nut to crack. Usually done during doing percutaneous nephrolithotomy. So what are the things that you are to do? Which one is a rigid deposit? Definitely it is the kidney stones, isn't it? So where do you get that? You get that from A. Why? Percutaneous nephrolithotomy is a surgery to remove kidney stones that are too hard to pass. So the answer is kidney stones. Which surgical tool can trigger post-operative urinary urgency and induce bladder spasms? So induce bladder spasms, urinary urgency. So where are they talking about? Definitely it could be post-operative, isn't it? So clearly they are saying post-operative. So post-operative in D. So what is the thing that is going to talk about all these? So it is clearly saying, so urinary urgency is there. So catheter is there. Okay. So what is that? Bladder, infusum, and all those things are there. So patient may have a catheter in the bladder overnight. It is common to have sense of urinary urgency from catheter. So urinary urgency is the bladder spasms. Okay. So the answer is catheter. C-A-T-H-E-T-E-R. Good enough. 15 to 20, these are called fill in the blanks question. Very simple. Only write what is missing. Okay. Now, instructions remain the same as what we have done in short answer. Redundancy you have to always look into. Should a stent be implanted during the procedure, patient will depart the tube, persisting in the renal and dash upon discharge. So they should remove that some tube, isn't it? Okay. So what is a tube? Where are they talking about? So again, go to D. Isn't it? Again, go to D. So where are they talking about in D? It is there saying if a stent was placed in the procedure, they will be discharged with that tube inside the kidney and ureter. So U-R-E-T-E-R is the answer. Dash stands as the conventional therapeutic approach for managing renal, arteriovenous, fistulas and arterial pseudoaneurysm. So pseudoaneurysm, fistula and all those things are mentioned where? Standard treatment is there, fistula is there, pseudoaneurysm is there. So the answer is selective angio-embolization. SELECTIVE-ANGIO-EMBOLIZATION. Good enough. Following the expulsion of renal calculi, kidney stone again, urologists may elect to instate either a drainage tube or dash To expedite. Expedite means to quick. What? Facilitating urine drainage. So where are they talking about all these? Definitely in B, isn't it? During. So after removing the kidney stone renal calculi, the urologist may install a drainage tube or a urethral stent. ureteralstent, and this drains the urine and promote healing. Good enough. Upon achieving sedation, so sedation where? During procedure, yes. So B, definitely, isn't it? It is somewhere during B only. Urologist will create an incision typically sizing around dash or less. So where are they talking about some sizes? So once you're asleep from what? General anesthesia, okay, sedated. The urologist will make a small, approximately 1 centimeter, 1 cm or smaller. Fair enough. The next. Urologists have performed closed dash percutaneous nephrolithotomy procedures between 2017 and a decade before. A decade is a period of 10 years. So 2017 is there. So before 2017 means 2007. So a decade. Decade means 10 years. A period of 10 years. So where are they talking about period of 10 years and all? Yes, between 2007, 2017, 20,000. Straight answer. Good enough. Changing the dash on the patient's back in the first day or two post-surgery is crucial for optimal care. So changing post-surgery. So what are they saying? The patient will have the gauze dressing on his back, and that will be made one to a few times over 24 to 48 hours, a day or two. So what are you going to change? Gauze dressing. GAUZEDRESSING. So I have fired my 20 answers. It's high time that if you have any doubts, you're always welcome to clarify. If not, do shoot. What are your total scores? Maria, absolutely stunning. 20 out of 20. Very, very good. Monica, see, this can be a factor, okay? See, you have to always remember, gauze dressing is it given as one word or two word in the text? If it is a typo error, no problem, yeah? So please look into addressing these kind of mistakes. See, these are mistakes which we don't take it as seriously. Okay, if it's a typo, see, when you're typing also, please ensure that you're typing, and also do write or do practice by taking printouts. Okay, so 𝐿𝐴 20, Mega Charles, absolutely stunning. Good enough, good enough. Keep it up, keep it up. Good, good, good. Excellent. Anybody else who have any doubts? Any doubts? No doubts. Good. You're all absolutely good enough students, okay? So Maria, thank you. And Maria started saying thank you. It's high time that I also start saying thank you very much for giving me another opportunity. And thank you so much once again for all the lovely students who have made to their dream, and for all the students who have not by Whisker, sorry. We are here to assist you. So until and unless I see you all tomorrow, adios.